Good evening, Alma.
Hello, Dr. Hill. How are you?
Oh, I was in the clinic today and I'm home now. I have to clean the house before the cleaning lady comes. Whenever I say that, people say, "You do what?"
I know exactly what you mean.
I would like her to come back. Right?
That's right.
Dr. Hill, this is the last time I'll be here. What's the problem? You got too much stuff around here. I'll stay home and help you a little bit. Oh, Lordy.
Hi, Nicole, and thank you for agreeing to participate. I guess we sent you that meeting invite before we got your okay.
That's okay. Happy to help. It was just a little confusing, but yes, I'm good.
All right.
Hi, Nicole.
Hi, Dr. Hill. Good to see you.
Good to see you. I guess we haven't seen each other in person in a long time.
We haven't, for as close as we are.
Right.
I'm looking forward to the graduation dinner.
Yes. Yep.
Is that face-to-face?
Yes.
Okay.
Yep, we're trying. It's going to be outside and hopefully the weather will cooperate.
That's your job, Dr. Hill, make the weather cooperate.
Well,
that's right.
I have to check my calendar. What date is that?
It's May 4th.
I'm sure, let me just, you know how it is. We get so much stuff, but let me just check.
Tuesday, May 4th.
Gotcha.
And for those that just came in, we're going to wait a couple more minutes and start promptly at 7:05.
I'm Ms. Anderson.
Good evening, Dr. Littles and Dr. Hill and Dr. Benzie and everybody else. Good evening.
Good evening. Good evening.
You're doing great things with STRIDE. I love all the stories and the articles recently and the CPR. I mean, just wonderful, wonderful things. So congratulations.
Well, thanks to my team and I put them first because they're working hard for the Sarasota campus. Jody, Lauren, and the graduate students and everybody. So can't take all the credit.
It's wonderful. It really is. And it's such an asset with the Sarasota regional campus. We're really excited to have everybody.
And I thank you for that, for giving office space and everything. Thank you so much.
Oh, absolutely. Yep.
Right there for us.
Hi, Megan.
Hi, how are you?
Good.
Good. It's pretty down here in Sarasota. The weather is gorgeous today.
Yes, it is.
Great, because we had rain. And we're supposed to have a couple of cool days coming up, I think, which is kind of amazing.
Yeah, I did hear that. I did. I'm at the soccer fields right now doing double duty. So,
yeah.
Well, thank you everyone for coming out tonight. We're going to go ahead and get started with our medical professional panel. So first, we're going to start out with introductions of our medical professionals on our panel tonight. I'll start with myself. I'm not on the panel, but my name is Kanai Nemore, and I'll be facilitating for this evening. And we'll go in the order of first our pharmacist, our PA, our registered nurse, and then our social worker, and end with our postdoc for therapy.
All right, so hello everyone. My name is Dr. Sean Wimberly. I've been a practicing pharmacist for about 10 years. I currently work with Tallahassee Memorial Hospital, and I also work part-time at FSU. Do you want us to go into the entire spiel or just do a brief introduction?
A brief introduction is okay for now.
Okay, all right, so I'll stop there.
So my name is Megan Verdoni. I'm a physician assistant. I've been a PA for almost 19 years. I did my undergraduate at University of Florida and have worked primarily in emergency medicine. And I now work for FSU as their Associate Clinical Education Director for the PA program.
Okay, Mrs. Culbertson, can you go ahead and do your introduction for us?
Hi, can you guys hear me?
Yes.
Awesome, awesome. Sorry, I was running a little behind getting here, so I made it though. My name is LaShonda Culbertson. I am currently working as a registered nurse. I've kind of worked in a few different areas, emergency room, medical ICU, public health, and decided to go back to school to become a nurse practitioner. But this is all my second career. Prior to that, I was a community health educator. So I have a master's degree in public health, and I did that for 15 years before returning to school for nursing. So nice to be here. Thanks you guys for inviting me.
Hi, everyone. My name is Summer Bray, and I am a social worker. I currently work for the Department of Children and Families. I'm currently in a contract management position. I started working for the department in 2005 in child protective investigations, and then moved on to a specialized unit called the Child Advocacy Center, which I supervised, and that dealt with egregious child abuse, a lot of medical neglect cases, broken bones, child deaths, and things of that nature. And thank you for having me.
Hello, everyone. First and foremost, thank you for being here at 7. I know back when I was in school, I would have not been here at 7. So props for that. My name is Dr. Michael Rodriguez. I am a postdoctoral clinical health psychology fellow with FSU over in their Immokalee campus. Specifically, I am in integrated primary care. So I split my time between a couple of the clinics that they have there between peds, women's, and family.
Thank you for those introductions. So now we're going to there's one question that we want to ask all of the panelists to start out before we open the floor for student questions. And that question is, what obstacles did you all face in achieving your goal in your current career? And then how did you overcome those obstacles? And we can go in the order we did the introductions.
Okay, so I would say my biggest obstacle was the fact that I really didn't have the means to, I didn't have parental support. I didn't have, when I went to school, in undergrad, I had Bright Futures, which was obviously very helpful. But then when I went to pharmacy school, it was basically student loans and I had to work. I didn't have the luxury of having my parents pay for everything, and I had classmates who did. And so, you know, it made it a little more difficult. I had to find a way to balance working as well as going to school. So I worked part-time, at least, while I was in pharmacy school. You know, I tell a lot of my classmates, not my classmates, my coworkers, when I started pharmacy school, I had an air mattress and a printer for my notes, and that's all I could afford. And, you know, it made me, I feel like it made me stronger in the end, because it made me value what I have now and what I've been able to do. But, you know, it did make it a little more difficult to try to succeed. But when there's a will, there's a way.
Thank you, Sean. So for myself, I did my undergraduate studies at Indiana University, and I did a bachelor's in biology. When I was in my junior year, I got involved in a relationship that went very bad. In fact, I ended up having to file for a restraining order on the gentleman. and had to transfer out schools. Therefore, my transcripts showed a ding and some grades that weren't up to par. I still managed to come back, and my grades after that dramatically improved. I had to go and talk to my professors who, at the time this all occurred, explain what had happened and ask for their support to try to improve those grades, and then start the application process for PA school. And the learning lesson, I think, from this is that everybody has mistakes or problems that they're going to go through in life. People that get into the PA school or any other program, they're not perfect. And they're going to have those bad things happen. It's all in how you recover. It's all in how you put it together. And when you sit down in an interview, that you have to explain what happened and how you improved, how you succeeded over that. That's what they're looking for. And so as a result, when I had got the interview for University of Florida and I had to sit down and they asked me about the grades on my transcripts that weren't up to par, I was honest and I explained what happened, and I had the documentation and was able to say, but here's what I did after that, and here's where I succeeded and what I've been doing since. And that's what got me into school. And then I was able to continue on from there.
So in my case, my journey, I don't know, I think we all probably are abbreviating our journeys a little bit. I appreciate what I've heard so far, and it resonates with my heart because I'm like, I know there's so much more behind that. But in my case, I was a straight A student. I'm going to go back as far as high school. I was a straight A student in high school. Did everything right, was involved in everything that you're supposed to do. And I had enough credits at the end of my junior year of high school to graduate early. So I went to FSU as an undergraduate, and I am technically a first generation college student. My mother worked and attained her nursing degree, but she didn't have like the full-fledged college experience. And so I went up there with very little understanding of how to navigate. I figured I was smart and that was enough. And it's helpful, but everybody's smart when you get there. And so initially I didn't do well because I didn't have study habits in place. I lost scholarships that I had. We didn't have, I think Brad Futures had just started when I got there. So I feel a little dated now. But the few scholarships that I had applied for, I lost those. And so I was funding through student loans, et cetera, the rest of my education. And then after that, I decided maybe a year or two after graduation that I wanted to go into public health. I had initially wanted to be a physician, and because of my grades, and I was told I had to major in biology, and that's not true. We know that now. We know, major in what you're passionate in, get the classes you need to get, if that's the route you want to go in. And so anyway, I had to fund my graduate education, and I experienced a job loss. I was laid off. My position was consolidated with someone else's. And so I had been wanting to go back to nursing school, but because I had a family that I was supporting, I didn't feel comfortable with just quitting work to do school full time. So that decision was made for me. And I didn't want to find myself in that position again. And I also wanted to be able to help my patients in a new way. And so it allowed me the opportunity to go back. But in this degree, in this career path, I've truly gone the full gamut. So I went back to community college. Then I went to a 4-year school for my bachelor's. And then now I'm at FSU again, getting my doctorate in nurse practitioner. So that's kind of my journey. I'm funding it now. So I pay as I go and I work full time, and it's challenging. And so, I know you hear us say a lot, pay attention to what we're telling you and try to do it right the first time. I had a teacher who warned me, okay, you're going to FSU, you might have a lot of fun and you may not get a second chance. And it is hard to get a second chance. It is hard for people to really appreciate you overcoming, and you do have to prove yourself a lot more. So not that you can't make mistakes, it's just some mistakes are really critical. And so, you know, we encourage you, get those people to surround you and, you know, support you. And I'm not going to cut off Michael's time. So that's just something I wanted to share with you guys.
I think it's my turn. Okay. Thank you. So my story's a little bit different. I didn't really have a lot of support from my family as far as academics. So not that they weren't a supportive family, it was just for things other than academics. So I really didn't know what I wanted to do in life. And so I initially went to TCC and I changed my major. I graduated from high school at 17. I ended up graduating from FAU with a bachelor's degree in 2005. I probably dabbled in everything, biology, teaching, dance major. I mean, all of the above. You look at my electives and everything that I have on my transcripts, and it's like, where was this girl going? I was going everywhere, just not where I needed to go. So through all of the first, 3 to 4 years I always tell people I have a broad spectrum of knowledge, kind of dabbled in everything. I really discovered that I wanted to work with people and realized that because I did have relationships in high schools with other kids that really had a lot of trauma and abuse that happened in their lives. And I always kind of wanted to work with people. I didn't really know what capacity that was going to be in. So I ended up taking a child welfare class as an elective, and I just completely fell in love with it. I just knew right away that was what I was going to do. Teaching kids was not my thing, but I wanted to be able to help them. So I ended up getting a job as a case manager for mental health, targeted case management. That was my first career or job after I did my internship and graduated. And then I ended up getting hired at the Department of Children and Families as a child protective investigator. I'd have to say that it was probably the most challenging career I've ever had in my life. But I think the challenges along the way, as far as my academics and being able to really narrow down where my focus was and my work ethic really helped me get me through to where I am today. I currently manage the child welfare contract for Orange and Osceola and Seminole counties, which basically they provide all of the foster care services, all of the whole gamut under child welfare for all of the children that are abused, neglected, or abandoned in those counties. And prior to that, I was the supervisor of the child advocacy unit, where I did have a lot of interaction with medical professionals. We investigated medical neglect and egregious abuse. And I think for me, the barrier in my career was being able to handle and be able to work with a family, engage with a family, knowing that a parent really harmed their child seriously, and being able to work through that, be able to protect their child and still keep them engaged in the process to help them at the end. I supervised that unit for 7 years. It was a 24/7 almost kind of job because I cared so much. We would get cases in over the weekend. When I wasn't working, I was always on my phone. I was always engaged in the process. And I think being able to have a strong work ethic helped me through that. And as well as, learning how to turn it off emotionally was a big challenge. So I've learned, and I know you can use this as a student as well. Like when things get stressful, you've got to find an outlet for yourself so you don't end up, harming yourself emotionally by the trauma that you work with. And also, that way you can help the families or your patients. So that's me in a nutshell.
Last but not least.
There we go. So Yeah, I think for me, the biggest obstacle came down to myself, if I'm honest. You know, like I kind of alluded to earlier, in high school, I mean, I was just kind of there showing up. Um, I really didn't want to go to college. It was parents, you know, kind of left no other choice. It's like you have to go. So there I went, enrolled in community college after a lot of nagging from my family. Um, and so I went, kind of trying to figure out what I wanted to do. Very much of the idea that I want to get in, out, you know, kind of do my thing. So I remember looking through the different careers and the different majors that they offer and just kind of being like, what's going to get me out of here the fastest, right? Like how can I make sure that I'm out, right? I'm out working and funding, you know, whatever I wanted to do at the time. And so that was kind of my mindset going into college. So kind of played around with different majors and different electives. Eventually, I did take a psychology class, and I remember being like, "Wow, this is really cool. This is neat." And then looking at careers with psychology and looking at the kind of trajectory and being like, "Wait a minute. So I have to finish school and then do another 5 years and stay in school for like ever, right?" Back then, it's like that's the rest of your life. So I was like, no, nope, I'm not, that's not me. I want to get out of here. So I think that was around the first, second semester of college. Eventually got to the point where I took another psychology class and kind of had that moment of like, I like this, right? What do I want, right? Am I just kind of escaping this and trying to get by in life, or do I want to do something that I'm passionate about, right? Do something that kind of brings me joy. And I think once I was able to kind of determine like, okay, I'm going to give this a try, it was that shape of like, wow, this is actually interesting. This is actually something I see myself doing. Like, you know, it wasn't, I mean, I still hated waking up early and going to class, but with the idea of like, this is actually neat what I'm learning. And I think it kind of developed and really started to enjoy it. So that was, you know, all through undergrad. And then, you know, you start taking more classes and really getting to the point where you're like, yeah, this is neat. And it um, kind of like nourishes that passion in you and helps motivate you a little bit more. You know, and coming to that crossroads again of like, okay, now I'm about to graduate. Do I apply to grad school? Do I just get out there into the real world? And, you know, I think a lot of that self-doubt that starts to set in, you know, and fortunately I have a very strong support system, really strong family, you know, and I was kind of able to push myself to that point of like, okay, let's do this, right? Like, might as well, right? Well, what's the point of doing, you know, what's the point of just skirting by on life, right? Might as well kind of grab it by the horns and do the best that you can with it. And yeah, 5, 6, 7, I'm at 7 years now, 7 years after that. Here I am still learning. I'm on a postdoc. You know, so I could have gone into the real world and gotten a job, but I decided to kind of specialize. And here I am, you know, still learning and doing it with open arms, right? As opposed to that grumpy me, you know, when I was 17, 18, hating school. So yeah, I think I've kind of been able to kind of overcome a lot of that and be where I am now.
Thank you so much. And thank you all for sharing your stories and your journeys getting to where you are today. I know this is a perspective that a lot of the students don't get to hear regularly. So we really appreciate you all being open and sharing with us. So now we're going to open the floor for student questions. How we're going to do that is that any student that wants to ask a question, you can type it in the chat and send it directly. You don't have to send directly to me, you can send it to everyone, but you can send it in the chat and then I will read out the question out loud. If you have a specific question for a specific person, please specify that when you send the question. But if not, I may choose to pose it to a certain person if the question seems to relate to one person's career more than another. And also, if you don't have your camera on right now and you're a student and you can turn on your camera, we'd really appreciate it if you can turn it on just so we can see your smiling faces. So we're going to go ahead and get started. If you have any questions whatsoever, please just go ahead and send them in the chat. Okay, we have our first question. So for Mrs. Verdoni, what is your experience in emergency medicine, and did you like the rush or the shift work?
A little bit of both. You know, I've done it for almost 19 years now. In the beginning, I really enjoyed the variety of cases and the rush of it. And the shift work has been great from a family standpoint. And as my kids are getting older, I find myself transitioning now, and I appreciate that I have the ability to work more clinic shifts. So I have shifts in the main emergency department of Sarasota Memorial, but more in the fast track now, but I used to have main emergency room shifts. But there's fast track, and then there's the walk-in clinics throughout Sarasota County. So I find that the walk-in clinics tend to be a lot more agreeable for family life. So life tends to change, and so do priorities. And that's been the beauty of this job, that it's been very flexible for me over the years.
Thank you. So we have another question. This one is actually for everyone. What's a typical day like for you? You can go in any order for this one if you'd like.
Go ahead.
I'm sorry. Yeah, so I feel very fortunate in the practice setting where I am, and I should have described it better. So I work at TMH, which is Tallahassee Memorial Hospital, and I work in a very unique setting called the TMH Transition Center. So what we do is we have patients who were recently discharged from the hospital, and a lot of these patients do not have primary care providers. And so my role is I work on a multidisciplinary team, and a lot of these patients, they either are uninsured, they're underinsured, they have Medicare, Medicaid, and we also see patients who are insured, but the majority of our patients are indigent. And so I work on a multidisciplinary team, and I meet with the patients, kind of figure out what their medication needs are, as well as make sure that their medications make sense for the disease state that they've been diagnosed with. And I also look and make sure that these patients can afford the medications that they're prescribed from the hospital. And if they can't, I'll either, speak with the providers about getting them on a regimen that makes sense, that they can afford, or I establish patients with patient assistance programs. So there's a lot of medication teaching, a lot of collaborative work, and making sure that they have a sustainable plan. So with that long-winded answer, my typical day, I work usually Monday through Friday from 9 to 5:30. And, it's just seeing patients throughout the day. And not only do I see patients in the clinic, I also make discharge calls So my day changes a lot. There's multiple responsibilities, as well as our clinic has been tasked with following all the COVID discharges. So any patient that was discharged with having a diagnosis of COVID, I also follow up with them, make sure that they have the appropriate medications upon discharge, and also that they have proper follow-up. So that's pretty much what I do.
I'll go after Sean.
Oh,
Oh, go ahead.
It's okay. You can.
Since I was after Sean, my day changes every day. I might be in the fast track of the emergency department one day, then I could be at St. Armand's at the clinic, then I could be at Northport Emergency Department, then I could be at the Venice Walk-in Clinic. And in between that, then I also coordinate my students for the PA program there at FSU here in Sarasota. So it varies all the time. It's full-time hours, but I do have nights, holidays, and weekends that get accounted into all that as well. So it's a lot of fun, but it does have kind of a variety of shifts and days. In a typical shift, I may have to see anywhere from 20 to 30 patients a day and make those decisions about their care. So that's kind of the average day for me.
Cool. I'll go next if it's okay. So I totally resonate with what I heard a little bit ago. I'm an RN in a care transitions program for Tampa General Hospital. So we just started our program and we decided that COVID was the first thing we would focus on. So we are a virtual clinic. And as part of the care management of the patients within that clinic, we have NP students and MD students, and now we're adding a pharmacy component. So we'll have our resident pharmacists as well as pharmacy students, all USF, University of South Florida students, which I can tolerate for a little bit, even though I'm at FSU. Anyway, so we help to manage those things. I kind of do what we call triage nursing, which is when patients call into our clinic and they're in distress or they're experiencing whatever kind of trouble, we talk them through it, assess them on the phone, which means that, we go through the questions of, you're saying you have a rapid heart rate, are you having chest pain, kind of going through all of that. And then determining whether or not this is something we need to filter up to our resident or attending that's in clinic. Those are both physicians, or if this is a case where the person needs to go to urgent care or the emergency room. And in some cases, I think we recently got a designation, the hospital did, as a COVID leader in academic medical centers, because we've reduced the amount of readmissions and first admissions, which is, a really big deal. I know it probably does not mean anything to you all right now, but it's a really big deal that people don't keep going back to the hospital, but that they're able to manage their care at home. So that's the whole point of transitions care. So it's nice to have a buddy in the field. So that's like my typical day. I work 12-hour shifts in my particular clinic, every other weekend in my case. And in between that, I'm fitting in school. So that is, and I got a family. I got somebody in college at FSU, freshman, and then someone in high school, as well as my husband. So nobody else said that, but I know everybody has family and other life issues that they're dealing with as well. But that part comes later. Don't you guys worry about that part per se right now. But yeah, that's more or less my day, and then trying to fit in fun time in between that. So.
I can go, I guess, a little bit about my day. So as I mentioned, I am in primary care. So depending on what clinic I'm at, depends on the clients that I see. But basically, I work 8 to 5 every day, not on weekends, which is nice. And it varies between scheduled patients, so patients that I've seen before, and then doing what we call warm handoffs, which is where our physicians will kind of come look for us for whatever kind of concern that requires a psychologist. So it could be, something like mood, like anxiety, depression. It could be something like, something that might require reaching out to DCF. It might be, just more of the behavioral stuff, right? So working on them to improve eating habits or medication adherence. So it just kind of varies. So typically, because it's integrated, they want a good mix where we're available for those consults and we're seeing patients that need it. So kind of my typical day.
Okay, I guess I'll go ahead and go. So I'm gonna kind of reel this back to when I was in investigations, because I think this pertains more to what I do now. And what I do now is manage a large contract and have a lot of interaction with community providers as far as service provision. But a typical day with an investigator is, or a supervisor is the abuse hotline is open 24/7. We take immediate response abuse investigations from 8 to 5 p.m. and we have on-call units that take immediate response, which requires at least 4 hours for an investigator to get out and make physical contact and eyeball a child. So it really depends on the flux. Usually Friday, Saturday, and Sunday nights are heavy hitters for investigations for a gambit of reasons. After a case has actually commenced and you make contact with the family, you're basically doing a very thorough interview to find out what happened regarding the allegations. That may entail taking a child to the hospital or to the doctor to be examined, or it may be responding to an emergency room where you have a child that's unresponsive and incubated. So, or it could be a child death where you're actually meeting with a family, the child's been pronounced expired, and you're trying to work with law enforcement to determine what happened to that child and if there's any criminal charges that are going to ensue because of that. If you have other children, or if a child is deemed unsafe in a home, then the department has to take action and we end up removing those children from a caregiver, hopefully placing with a relative, non-relative, or a family friend, as opposed to putting them into a licensed foster home or a licensed group home. After that is completed, then we go to a shelter hearing in front of a judge, and we basically write a petition with our legal department explaining the reasons why the state of Florida has taken those actions to place the children in the state's custody, essentially. And from there, just like in a criminal proceeding, a judge determines whether or not there's probable cause to keep that child in the care of the state. And then from there, there's a judicial proceedings where a parent caregiver basically is given a case plan, and we assess their protective capacities to see what went wrong, essentially. How can we help them to become a better parent and to be able to provide a safe environment for their children, so with the hope of returning them into the home. Not every case turns out that way. Sometimes people make reports because they're angry. It's up to us to determine if it's a real situation or not. And we also have to look at the criminal history and prior abuse history, and also the familial history, to really make a better assessment of maybe there's not danger now, but there are a lot of things going on in the home to where there could be danger, essentially. And we have to still intervene, maybe not on the extreme end of removing a child, maybe just adding some case management into the home to really build those protective capacities of those parents to ensure that the danger threat in the home is gone. So ultimately, you could have a really great day where you meet good people, or you could have a really bad day where you're up for 48 hours straight trying to ensure that, you're keeping the kids on your caseload safe. So it's really just a flip of a coin.
Thank you all for answering that question. I have a question for Dr. Wimberly. It's about study habits. Someone asked, in your opinion, do good study habits naturally come with time, or do they require work to get to a certain level?
Mm-hmm. I would say they definitely require time to get to a certain level, because, you know, in undergrad, it wasn't really hard for me to study. It was basically what we call plug and chug. And so a lot of it was rote memorization. Whereas when I went to pharmacy school, it was more conceptual based. And it was a lot of material at one time. You know, you're taking, 19, 25 hours of coursework versus when you were in undergrad, it was 12 hours. And, one thing I didn't mention was that I received my bachelor's degree from Florida State in chemistry, and then my doctorate of pharmacy degree from UF. But I'm still a Seminole fan. But yeah, it does take time. You have to figure out what works for you. And what works for you may not work for someone else. And it's a lot of trial and error. Like for me, as someone else said, I was balancing work. I had family issues that were going on at the same time. So I did make some grades that I didn't feel were reflective of, my aptitude. But what I did was I spoke to professors, I spoke to students who were performing better, and I figured out, okay, what are you doing to be successful? And kind of going off of that and trying to figure out what works for you is a way that, pushed me to where I am today.
Can I comment off of what Dr. Wimberly said? That is so true, that if you are struggling, if you see other people that are doing well, ask them what they're doing and try modeling some of that behavior. Because when I have to counsel students who have not done well on a test or not doing well at all, a lot of times it's because they're trying to study the way they've always studied and they're not adapting new habits. And it takes talking it over with friends, the material, reading it, listening to it, saying it out loud. You have to do multiple different types of studying. And it doesn't mean you have to study forever. It just means that you have to have a really focused study plan, and that you put serious intent when you are working with that material, so that it's serious time that you're spending on it versus answering your phone, Instagram, or Facebook while you're studying at the same time, because then you're not really retaining it. But that is such a true point. If you're struggling and you have friends that are doing well, ask them what they're doing and start working with them.
Very good. Thank you both. So this question will be for Dr. Rodriguez. What would you recommend when applying to college? I'm debating with a small university versus a big university.
I think it comes down to personal preference. I did my undergrad at Florida International University when I transferred over from a community college. It was a really big college. You could kind of, fall through the cracks and not really get to know professors, and it becomes a lot harder to get, letters of recommendation if that's what you need. So I guess in that sense, if you're not the type to kind of, actively go out and visit your professor's, office hours or anything like that, and you think you need a more intimate setting, then yeah, I mean, I think a smaller university would benefit. But yeah, I think it comes down to personal preference. I don't know.
Thank you. So this question will be for anyone that would like to answer it. It's a general question. What was one thing you would say is a personal necessity for your field?
I would say compassion. I think most of us, just at what I've listened to, everybody is in their field because they want to help people. And sometimes that's really where you start. You just know you want to do something to impact people in a positive way. And so I think compassion sounds kind of, I don't know. It just sounds soft, but it's the truth, because it will carry you when it gets tough and you're like, why am I here again? What exactly was the purpose in all of this? I really don't care whether or not I become this thing anymore. You have to remember why you're doing what you're doing. So I think compassion is really important. And I also think tenacity, which is something that I heard and I really admire in everybody that I heard here. You have to have some kind of fight in you that says, it's tough and it's bad, but I can't quit. I got to stay in here. And I think all of us, we've had to, that's part of, growing and maturing as a human. You do have to step back and be able to say, well, I need to do this differently. I want to do this, but maybe I need to change it up. As you talked about with study habits, it happens in life. There are things I had to just start over and do differently in order to get to where I need to be. And then be gracious to yourself. Allow yourself. You wanted to be, the Nobel Peace Prize winner by the time you're 22, and it happened at 32. Darn. Who's counting? It's okay. You give yourself a little bit of grace and a little bit of time to live, but just make the most of those experiences. So hopefully that answers that person's question. From my perspective, that's what I would say.
I think that was a very good answer to the question. So thank you. This question is for Mrs. Rodoni. What do you like most about your work/job?
I really enjoy helping my patients, the ones that haven't been maybe given the best resources for their medical care. Nothing makes me happier than when I have a person who needs help learning how to use an inhaler because nobody's ever showed them before. And they realize that that's going to make a big difference and improve their feelings and symptoms. And I enjoy mentorship and professional development with my colleagues. But I also really enjoy when I have patients come in and just getting to meet them and know their story, because often the answer is in their story and in their life. And I just, I always find it very interesting and that I can be a part of that.
Thank you for answering that for us. So I have a question for Ms. Bray. It's, in your experience, what kind of clients are most difficult to work with, and how do you handle an aggressive client?
Okay. Well, to be quite honest, when you first knock on someone's door and tell them that they've been accused of abusing their child, usually they're pretty difficult, to be honest. But what I've learned is that you have to be very open-minded, and you can't go in there with any preconceived notions. You really just have to listen, because ultimately, no parent wants to harm their child. They all across the board want the best for their child. Sometimes they just don't have the tools to be a safe parent. And so what I've learned is the majority of them are difficult because they don't see that piece, and working with them to understand their story. And many times they are also victims of trauma. It's generational, that they don't understand how to be a protective parent. So ultimately, really just trying to work and communicate and listening and understanding and asking those questions to really know what you're jumping into, to understand what's going on in that home, to help them be a better parent. As far as aggressive clients, again, think about it. Somebody knocking on your door and saying, you're not being a good parent. 9 times out of 10, they're upset. I think just again, the listening portion and trying to let them know that you're there to help them, not be adversarial. I have seen other investigators or social workers where they take a different approach to families, where it's more of a police officer approach, and I'm telling you, it does not work. You know, you really have to care about, have compassion, like LaShonda said, and really care about what you're doing and really want to make a difference, and listen to folks, because ultimately they want to be a good parent. They just don't have the skills and they don't understand how to get there. And that is our job, is to help them do that. So I think when you're dealing with someone who's at the height of rage and anger, you really just have to give them space and let them say what they're going to say. And then, you know, just acknowledge that you're listening to them. If it gets to the point where it's, you know, too crazy, we usually have law enforcement there, but typically I would always try to circumvent that, because you know, law enforcement is there for a different reason. They have a different role. And a lot of times they are a barrier to getting to know what really happened and understand the dynamics in that home and the environment. So, you know, I think just when anyone's angry, you have to give them space, but also acknowledge that you're listening and you're there to help.
Thank you for giving us that insight. So Mrs. Culbertson, can you give some examples of your problem-solving skills?
Oh boy. Well, they come from many places. So, example of problem-solving skills. Well, I will tell you a little bit about how I developed them, and hopefully that will tell some examples of them. So I developed them by knowing my field, right? So when we study and want to be a professional in whatever area, it's really important to know your field. And what I mean by that is there's like a baseline level of what you should get. And some of it comes just by virtue of being interested. Some of it, you know, you do have to open the books and kind of pull from that. And then as far as, oh gosh, what problem skills I have, I think one of the things that most people say about me is that I'm resourceful. So like Summer, I kind of worked in multiple areas as a nurse, but prior to, when I was a health educator, a lot of the communities that I worked with, I worked for one of the cancer centers here in Tampa, and I worked in the outreach program, which meant that most of my patients didn't have insurance, and it inevitably, you would be doing some kind of educational program, or back in the day, we used to do a lot of health fairs, whatever. And so somebody would not have insurance and they may have a lump, like we taught them to do their breast self-exams and now they've got a lump, or, you know, they're saying, oh, something has been weird or different. And now we've got to navigate them into the system. So being resourceful, knowing what is out there. I think surrounding yourself with smart people, not only for good study habits, but there are people that are always smarter than us, and they probably think we're smarter than them, which is weird, but whatever. Like I'm on this panel with all these folks and I'm like, these folks are absolutely brilliant. And maybe they think I might be a teeny bit smart too. And so just knowing those kinds of individuals, somebody always knows someone somewhere. So, you know, don't burn your bridges. Even with people that can be challenging throughout life, you never know when you run into someone again, and life and time may have changed things for them. So maintaining, you know, connections with people, et cetera. And then that leads to, let's think about how to work through an issue that we may have. So I may, you know, with a patient in particular, if we're dealing with a problem, I may go through my list of knowledge and talk with that patient about it. But then I also very much believe in including the patient in the problem solving process. So I have some thoughts in my head, but you tell me what you're thinking, because I ultimately want my patient to maybe do something. Like if we're having trouble with your blood sugar, I could give you a list of things to eat, but if that's not even in your diet, or all you're really committed to doing is giving up cake, you're not gonna eat fruits and vegetables. It's just, okay, I can let go of cake and cookies. All right, let's start there. And let's talk about why we need to add fruits and vegetables, but let's start with the cake and go from there. So I think it's a little bit of that. I think it's a little bit of humility. Sometimes it's the answer that's right in front of you. I think all those things, you know, using your resources, knowing your resources, and being humble enough to say, I need help. All help with problem solving.
Thank you, Mrs. Culbertson. This will be our last question, and I'll direct it to the entire panel. For everyone, how do you manage time with professional life and your personal life without it becoming stressful or overwhelming?
I would have to say that, you know, you just have to, you know, like what it was said earlier, sometimes you have to ask for help. So sometimes it will become overwhelming. A lot of it really helps if you kind of prioritize. I know, like someone else was alluding to, you have to listen to the patient. A lot of times when you listen to the patient, it can kind of guide the treatment plan and kind of make it a little easier to do the day-to-day stuff that you have to do. You know, days are going to be stressful. And what I like to do personally is I like to run. So I'll run, I'll meditate, do yoga. I'm also very active with Florida State, the Marching Chiefs. And so I find a creative outlet, and, you know, I'm a coach for actually the majorettes. And so I find things outside that I enjoy doing to kind of balance my personal and my professional life.
To find balance when you have so many different activities going on, I think it's important to make sure you schedule some time for self-care, meaning that you find time to exercise, recognize when life gets unbalanced, and sometimes you have to make choices about what's most important. And I mentioned earlier that the nice thing about my job has been that it has had a lot of flexibility for me to make some of those changes, because your life will change. It does adjust. First, you know, you start working, and often you may not have any children, and then you have children, and those needs change, or your spouse's needs change, or your health changes. And these are all things that you just have to be open-minded, listen to your body, listen to your partner, your spouse, and your family when they say, hey, I think you need to make changes, because often they're doing it in your best interest. And as Dr. Wimberly said, have a creative outlet. That's very important, something that helps you to relax and that you always find positivity. And make sure when you start your day, I really go into work and tell myself that it's going to be a good day. And I really try to make sure that I see the positive in whatever the chief complaint is of every patient, because you know, that's putting yourself in a positive mindset is the best way to have a positive day and a positive outlook.
I can go. So yeah, I mean, I echo everything, you know, the rest of the panel has been saying. You know, finding those strategies that work for you. Setting boundaries. I think for me, that's a really big part of my job is, you know, setting those boundaries, trying my best to not take work home with me. You know, it's very easy, you know, in the role that I'm in to, you know, you deal with trauma, you deal with, you know, parents getting, or kids getting taken away from parents, you deal with, you know, I've had to, you know, have the cops show up on a patient, you know, so it's real easy to take that home with you. So having some sort of routine or some sort of kind of strategy to not let that happen. For me, it's been my drives. I have 45-minute drive where if I need to kind of think through a case or kind of process all that information, I do it then. That way, when I'm home, I know that, you know, as best as I can, I'm not touching that again, you know, because it'll start to weigh on you. you know, if you're always taking it home with you. So yeah, just kind of having those boundaries and knowing, you know, when to say no, when you don't have enough time to do certain things, right? It's real easy to be like, yes, I'm going to take on this. Yes, I'm going to take on this. Yes, I'm going to take on this. And then you look back and, you know, it's all professional life and no personal, right? So learning to, yeah, set those boundaries.
So I would say, again, I think no one said anything I wouldn't say. Something that kind of came to mind was during the pandemic. It became during the, like it's over. At the start of the pandemic, I want it to be over. I know we all do. Okay. So anyway, at the start of the pandemic, when everything shut down, it was really hard to identify, even more so, ways to be involved in your creative outlet, because, you know, it was like every time you felt like you sipped the air outside, like, oh God, I'm going to get COVID. Let me go back in the house. And so I had a good buddy who, since I live on the west coast of Florida, I had a good buddy who would go out to one of the beaches headed towards Clearwater area. And she invited me one day and we just sat out there and just looked at the water. And I was like, oh, I can do this safely. And I'm not, concerned. And it kind of started driving my head into thinking about other things that I could do safely. And so, I have water balloon fights with my family, and I fill up water guns, and we are in the yard and yelling and screaming, and it's tons of fun. So, I try to balance some, and honestly, the water balloon fight, it takes 20 minutes to do, quite honestly. You fill up the balloons, everybody throws them out, it's over, but you've had fun and you're soaking wet, and it just gave you a minute to kind of break away. I also color, which might sound weird, but they have coloring for adults now, which whatever, I'll take a Mickey Mouse page, I don't care. But I do coloring just to kind of take my mind into something else for a little while and then come back. Of course, walking, all those things help to balance it out, because you pour in so much. And when you're in a caring field, you really put yourself in, and you have to be able to pull out, because it will continue to suck on you. Even though you're like, I need a break, and everybody sees you need a break, there's always one more shift to work. There's always, one more patient that, let me just call one more, let me just handle this. And you really have to be able to, I heard boundaries earlier, you really have to be able to set that aside, because you're a whole person. You're not just your career. You're not just your studies. I like to paint my fingernails every once in a while. I like tennis shoes. I like to play, what is that called? Mancala, which is the stones you put in the little, everybody doesn't know about it, but whatever. I like to do little things like that, or play cards. I play dominoes with my parents now that we're all vaccinated. So, just little things like that to make sure that you do the balance. You have to be thoughtful about it. And if you build the habit when you're young, it'll be much easier. It was after children and after life kind of hit me and I had to reset that I finally did that. But if you learn to do it early, it'll pay off. And the 10 minutes you take to do it will not distract from you being able to make an A on your test. It will probably make it more likely that you'll make the A on the test.
Okay, I'll just wrap this up quick. I'm just gonna echo what was already said. Finding time to exercise. For a lot of years I didn't. And, making a time early in the morning to get up and go and run is one way to relieve the stress. And then also, when there was downtime, to really take advantage of that. So I'm a huge fan of skee ball at Chuck E. Cheese, and I go with my best friend and her daughter as much as I can. And let me tell you, I'm pretty good. And I get her all of the tickets. So just making the most of the opportunities you have. I did find myself getting sucked in, on Christmas, looking at my phone, answering calls, and you just really have to have good supports with your coworkers, with your boss, your supervisor, what have you, and know that you know, it's going to get done, and you have to take that time, or else you do yourself a disservice, and you do your families that you work with a disservice too. So.
Thank you all for answering that question, and thank you all for being on this panel tonight. It's really awesome that you took time out of your busy schedules to come join us. And then on top of that, it's great that the students get to hear a very authentic take on the careers that you have, because I know a lot of them are interested in these careers as well. So it's good that they get to see that now as they're making those decisions and preparing for those careers. And thank you to the faculty that were able to come out tonight as well. We thank you for being here. Thank you to the students for coming. We hope you're able to get something out of this event and to learn about what the future takes, and to also see that maybe things won't look how you thought they would, but in the end, they will be okay and things will turn out how they're supposed to. So thank you to everyone that came. We really appreciate you being here and for participating with us.
Thank you.
Thank you.
Thank you. Good luck, everybody.
Bye, thank you.
Thank you. Bye, everyone.
Thank you.
Increase our force protection condition level.